Hello, my name's Darryl Hawkins. I'm going to run through some of the theory required for this first aid course, and that will only leave you the practical to come in and finish off in our place of training. First of all, we'll start with the legal considerations. As a first aider in the workplace, you have some legal considerations to adhere to, and we'll start with the skills and limitations. You're only expected to do what you've been trained to do and what your skills allow you to do. When it comes to duty of care, that's important in the workplace. If you're a first aider in the workplace, you are expected to provide first aid when it's required, and in any other situation where you may be the person who's responsible for a group, you would be required also to provide a duty of care to anyone who may be injured. Providing first aid, you need to get consent from the patient if the patient is conscious. So you would approach the patient, introduce yourself, and get permission from that patient to allow them to be treated by you. If they're not willing to allow you to get consent, then you can't force first aid on them. However, you could call an ambulance, and then the ambulance will be able to deal with the patient when they arrive. If it's a child, you need to get permission from the parent or guardian if they're available. If the parent's not available, then you could get permission from the child as a last resort to provide first aid. If a person is seriously injured and you believe that they need immediate first aid treatment, then if they're unconscious, you can certainly treat them without getting consent. Negligence. When it comes to negligence, a lot of people involved in first aid worry about negligence, and providing you do nothing more than what you've been trained to do, you shouldn't have to worry about that. And if it does come to negligence, the law courts would have to prove that there was some intent by you to do damage to that person. So if you didn't intend to injure the person doing first aid, there's no way you could end up being charged with negligence. Then reporting. When it comes to first aid, there'll always be some sort of report needed, whether it's a verbal report to the ambulance when they arrive, or some more formal type of report for your workplace or for other people to look at. So some sort of reporting will need to be done. If you are going to do reports, the report that we see on the screen now would be an excellent type of report, and that allows you to write in all of the things that would be needed on a report. If you don't have a report sheet like that, then at least if you get yourself a piece of paper and write everything you think may be of benefit to the people you're handing the patient on to, that would be the suggested thing to do. And this day with modern phones, if you do write a report, it would be a good idea for you to take a photo of it yourself to keep in case it's needed at a later date. When it comes to the people doing childcare portion of the course, all right, we're still going. Yep. When it comes to people doing the childcare part of the course, there are some special requirements needed, and if any child becomes injured, the regulatory authority needs to be notified within 24 hours of the incident occurring, and that would apply to the death of the child or any incident where while the person is being educated or cared for in an educational care service. Any incident involving serious trauma or illness to the child also would need to be reported, and that would be where the person needs urgent medical attention, or the child should have been sent to hospital for things such as the whooping cough, broken limbs, anaphylaxis and so on. Any incident where the attendance of emergency services at the education and care service premises was sought or to have reasonably been sought. Other things where you would have to make a report to ASICRA. Any incidents involving children must be recorded, and regardless of the severity of the injury. Notifications, you need to notify the parent or guardian. They should be notified and asked to acknowledge the incident by signing a copy of the report form. The centre director should be notified. Any educator involved in the child's care should also be notified. And any serious injuries, you need to again notify the regulatory authority. What is first aid? First aid is what you see there. It's just the immediate temporary treatment of somebody who has a sudden illness or injury, and what you do prior to the ambulance or medical aid arriving. And that includes all the basic life-saving skills you're going to learn. You do the best you can with what you have. When it comes to first aid, we like you to do first aid in a particular kind of way. We expect you to do respectful behaviour and be aware of cultural awarenesses when you're treating people. Try and be as professional as you can and reassure the patient that you're competent at what you're doing. Worry about the patient's privacy and confidentiality, and provide privacy when it's needed. And you're bound by laws to not pass on any confidential information to anybody who may want to know about things. You can only pass it on to those that need to know, such as the doctors, ambulance and so on. The Australian Resuscitation Council, they are an organisation who gives us guidance on how to teach first aid in the community and how first aid should be provided in the community. And the peak clinical bodies may add an additional little piece of information that they may require you to do as a first aider in their particular workplace. You need to maintain your skills and knowledge, and with a first aid course, it's every 3 years you need to renew your certificates, and CPR it is every 12 months if that's what your workplace requires. Then when it comes to communicating details to paramedics, the answer to the report form that I mentioned there before is excellent. You could give a verbal report to the ambulance, however a written report is always better, and that's why if you can write down as much information on a document and hand that on to the ambulance when they arrive. After you've done first aid, it's always good to sit back and think about how you went with the job in hand and whether you did everything you possibly could. Is there any ways you could have improved what you've done? And take measures to improve them for next time you provide the first aid. Then stress management techniques. It may be that you'll find that you're very stressed after providing first aid, particularly in a serious situation. And we like people to be aware of the fact that they could have become very stressed and may even need some kind of extra help. The stress management techniques we recommend are you talk to friends, family, counsellors, the psychiatrist or Lifeline or any other organisation who may be of some help to you in your situation. Be aware too that there could be psychological effects on others that are around at the time, and that may include children or other people that were around when you were providing the first aid, and you should try and be aware that they may need some help and support as well. When you turn up to do your first aid, you should always perform a survey first before you arrive and look out for danger to yourself and anybody else, and make sure that the danger has been eliminated before you rush into starting to provide first aid. We have an action plan which is standard for every organisation who teaches first aid, and that's called the DRS ABCD plan. With that, the first thing you need to look out for is the danger when you provide first aid, and ensure that there's no danger to you or anybody else around. Then response. To check the patient's response, the primary way to check is to talk to the patient and approach the patient, talk to them and try and get a response. If you don't get a response from the patient, then you could grab their hands and say, "Can you squeeze my hands?" Try and get a response in that way. If the person responds by squeezing your hands, then at least you know they are hearing you and they're still alive. If it's a baby, you could check for response by tickling the baby's hand, tickling their feet, or maybe tickling the side of the body, and you should get a reaction from the baby. The next thing is the S, is the send for help. As soon as you possibly can, you should send for help if that's what's needed. And if you think a defibrillator may be required, if possible, someone should be trying to find the closest defibrillator. With airway, that's the most important thing when it comes to treating people, and above everything else, they must have a clear airway and be able to breathe properly. When you arrive there and you've checked the patient out, if they don't appear to be breathing adequately, then you may step into the next part and start CPR. When you're checking the breathing, you'll need to possibly position the patient on their side to start with, tip their head back and make sure the airway is clear. If the person has a clear airway and they're breathing, that's fine. If the airway isn't clear, or if they're breathing inadequately, so that may be like not taking very many breaths per minute, or they might be gurgling or making other sorts of noises, but there's no obvious air movement in and out of the patient, which you would detect by looking at, you might see the abdomen moving, and you may look, listen and feel for air going in and out of the patient. If that's not there, then the next thing you would do would be to start CPR. And when you start CPR, we've got a set way of teaching that. You would roll a person back onto their back. You would then start by doing 30 compressions and 2 breaths. You continue that 4 times for 4 cycles, and then you would continue to keep doing your 4 cycles of 30 compressions and 2 breaths until the ambulance arrive. And if need be, if a defibrillator is available, then you would get the defibrillator and actively start to use the defibrillator on the patient. All of that we'll show you in more detail shortly when we demonstrate how the CPR will be done. So just going through them again, when it comes to danger and safety, the things which we've got on the board there will be the things to look out for: hazards, risks, any other dangers such as fire, electricity, sharp objects and things like that could be around. Be aware of communicable diseases, and when it comes to manual handling, don't do anything where it may cause you injury. You always try to get help if need be when you're lifting and moving patients. Response, we've got a memory thing that we like to use called COWS, and when you check the patient, you use the touch and talk method first of all, and then you can use COWS. You can say, can you hear me? Can you open your eyes? What's your name? And get the person to squeeze your hands. If that person is groaning and moaning and not responding, then that would be enough for you to consider to do CPR. And I've already mentioned, for infants under 1 year, the tickling might be the way that you can try and get some response from the patient. When it comes to sending for help, 000 is the number in Australia you use for sending for help. And if need be, you could try 112, which is the international emergency number on your mobile phone. So they're the 2 numbers that we recommend you use when you're calling for the ambulance. There is another app which is brilliant to put on your phone, and that's the Emergency Plus app. With the Emergency Plus app, it's a free app. You put it on your phone, it won't take very long to load, and it has some very brilliant things. You can call 000 instantly. You can call the SES if need be, police if need be, and down the bottom of it, it will give you the latitude and longitude of where you are at the time. So if you're out in the bush and nowhere near a street or a road, that can be helpful to the emergency services, and it will tell you the address of where you are at the time. And you may be somewhere where you're not used to location, so that can be really handy. All right, then when we come to check the airway, before you tip the patient's head back, you should look in the airway and see if there's anything in there. If there's vomit, broken teeth or anything that could be a problem with the airway, you would roll a patient over on their side, get rid of all that and clear the airway. Then you can tip the head back using the chin lift and jaw support. For babies, you don't tip the head back, so for infants under the age of about 1 year, you shouldn't be tipping their head back because that can obstruct their airway. Breathing, we tell you to look, listen and feel for breathing and make sure that the person is breathing normal breathing. If breathing is abnormal and gasping or not normal, then that wouldn't be adequate for the person's oxygen intake, and you would need to then get ready to do CPR. When you come for your practical, we'll show you how to roll a person who's unconscious into a recovery position to ensure that you can get their airway clear and check their breathing. Make sure that the adult patient, the head is tilted and the face should face towards the floor to allow drainage of any fluids out of the patient. With a spinal injury, there's a special technique called the log roll, and we'll be able to show you how to do a log roll of a patient who you believe may have a spinal injury. As this picture shows, pregnant women ideally should be rolled onto the left side if that's possible. Then we get talking about a cardiac arrest. Recognition of a cardiac arrest. The cardiac arrest is when a person will be totally unresponsive, not breathing normally, or maybe not breathing at all. The ambulance should be called and you should straight away be starting CPR. CPR, the aim of CPR is to get oxygen flowing around the body and therefore stopping the tissue death in the body and any other parts of the cells and organs in the body, making sure they get a good supply of oxygen. It needs to be done as soon as possible, and the body can only go without oxygen for a very short time before serious things start to happen. There's a special way we train you in CPR in Australia, and that is we do 30 compressions and 2 breaths on the patient. The depth of the compressions ought to be 1/3 the depth of the patient, and it should be in the centre of the chest towards the lower half of the sternum. The rate is 100 to 120 compressions per minute, and you try and do, that's about roughly 2 compressions per second when you're doing a CPR, and it needs to be hard and fast. You've got to push the chest down adequately to compress the heart and the lungs. If the person starts to breathe normally, then you would put the person into the recovery position, monitor their airway and breathing and ensure that they're breathing adequately. If any vomiting occurs, the same thing, you would have to stop your CPR, roll a person onto their side, clear their mouth, reassess their breathing, and if need be, continue with CPR. If you're unwilling or unable to do the rescue breaths and mouth to mouth, then CPR compressions are adequate, and we say any attempt at resuscitation is better than no attempt at all. Yes, so you need to be doing a CPR as soon as possible. All right, and infants and children, the same thing, as soon as possible. When do you stop CPR? You may need to consider that. When another first aider takes over, when professional help arrives and takes over from you, if the casualty starts to breathe normally, if the situation becomes too dangerous for you to continue, you become too exhausted and you can't continue, or if a medical doctor arrives and tells you that it's now too late and you may as well stop the CPR. When it comes to children and babies, we say a child is usually from 1 to 8 years, an infant is usually 0 to 1. The ratio of compressions is still the same, it's 30 compressions and 2 breaths, 1/3 the depth of the chest, and 100 to 120 compressions per minute, and that's around about the 2 compressions per second. The chain of survival is something that's been created recently to make you aware of cardiac arrest and how first aid should be provided, and providing none of the links of the chain are broken, the patient has a very good chance of surviving. It needs to be early access and call for help in a hurry. Start CPR as soon as possible. Defibrillate the person as soon as you possibly can, and hopefully early arrival of the emergency life support or ambulance. Defibrillator, you'll be trained in how to use a defibrillator, and you may see the AED sign around places in the supermarkets and places like that. If there's a defibrillator within view, you don't have to ask permission to use it. You'll be able to just grab it and provide defibrillation if that's what the patient requires. For adults and children, the right pad goes to the right side of the sternum, as the picture shows you here, between the collarbone and the right nipple. The left pad usually goes outside the left nipple and several inches below the armpit. If the pads are applied the wrong way around, the AED will usually still work, and they're very sticky, so once you put them on, you should be leaving them there. If it's a child under 0 to 8 years, the AEDs are safe to use on children between the ages of 0 and 8, but ideally, if possible, they should be used in a child mode, or child pads should be used if they're provided, but you may find a lot of AEDs won't have child pads available when you come to need one. So when you look at an AED, it may have child pads. It may be that you can swap the pads over that are there, or there may be a switch or a key which you can turn into the child position when you're going to use the AED on a child. If no child pads are available, they say adult pads may be used on the child, but ensure that they're not touching each other, and if need be, you could put them on, if they're too big, you could put one on the front and one on the back, as you see in the diagram here. When it comes to your defibrillator use, what we tell you to do is your DRS ABC. Hopefully someone finds a defibrillator in a hurry. You get the defibrillator switched on. With some defibrillators you may have to press a button to start them. Others, as soon as you open the lid, they will start, and they will have voice prompts to tell you step by step what to do. But if you're aware of how to use one, you don't necessarily have to listen to the voice prompts. You could just get the pads on as soon as possible. Then the defibrillator, once the pads are on, it will realise that they're on, and it will analyse the heart, and if it believes that a shock is advised, it will tell you that a shock is advised, and it'll tell you to stand clear, and it will either deliver a shock itself or it'll allow you to deliver a shock. If it believes that a shock won't be of any use to that patient, it will say no shock advised, and you'll continue your CPR. Alright, so now we'll step into doing CPR. We'll show you the lateral position, or the recovery position. So we'll now demonstrate a recovery position for you, and then we'll go on to doing the CPR and the defibrillation. Alright, I've got Henry here who's going to be a patient for me, and I'll show you how to do the recovery position. Alright, what we do is you come along and introduce yourself, no response from the patient, then you kneel down beside the patient and put one arm straight out like that. This one goes to around about the shoulder area, bend the knee up like so, and if you're a very small person, the patient is very large, then by pushing on the elbow and pushing your hand through here onto the other leg, that will allow you to easily roll the person over. The person will then roll over here, you come down, put your hand on the abdomen to feel for breathing. You look, listen and feel for breathing here, and it may be that you'll have to open the patient's mouth, maybe scoop out vomit if that's required, and maybe reposition the head so the head is facing down. Alright, so that's simple as that, and we'll get you to practice doing that when you come into the class. Alright, that's all we should do tonight. Then we want to go straight into the defibrillator. Alright. Still going to talk about Yeah, all right. So if you got to the point where the person's going to need CPR, then what you're going to do, if you wanted to trial mouth-to-mouth in class, we will have shields that will be available for you. Otherwise, you can simply be faking that, and when it comes to blowing the breaths in, you'll just go, show us that you are aware of doing the breathing. Got to locate the place to do the compressions on the person, and that's the centre of the chest and towards the lower half of the sternum. At about that point there, you usually grab your own wrists or lock your fingers together, and so that you can push up and down on the patient. And the compressions need to be straight up and down, not on an angle. If you push them on an angle, you could end up sliding across. So we need to be directly above the patient. Then you start your 30 compressions at the rate of 100 to 120 compressions a minute, which is around about that fast. And you'll be counting, you go 15, 16, 17, 19, 20, 30 compressions. Then it would be a matter of tipping the patient's head back if they're an adult, grab the jaw and support the jaw, and in the classes today you can go your 2 breaths back to the compression location and 30 compressions again. So you continue that for 2 minutes. If the patient recovers, you'll roll them onto their side and clear the airway again. If not, you'll continue your CPR until the ambulance arrives. But then we've got a baby. With a baby, you can do the CPR on a table, or some people will do CPR on a baby like that on their arm. You've got to find the lower half of the sternum for the compressions, and you'll be doing 30 compressions as quickly as you can with 2 fingers. So it's and we'll say 25, 26, 27, 28, 29, 30, and again 2 puffs, but don't tip the baby's head back. The baby's head must be kept in a straight line, and that's where sometimes carrying on your arm is an easier way to do it. If you happen to have long fingernails, or you don't want to do the compressions that way, another way can be to use your 2 thumbs like that to do the compressions. Alright, and you continue until there's some recovery, or that's it. Then with the defibrillators, all defibrillators are a bit different looking, but most of them will tell you step by step what you do. With this particular one we've got here at the moment, there are adult pads and child pads, depending on what you're going to be using them on. So these ones here, turn it on, and you listen to the instructions.
Apply pads to patient's bare chest. Plug in and connector next to flashing light.
Do it all here.
Apply pads. Plug in collector.
Rightio, there's your connector.
Apply pad. Analyzing heart rhythm.
So someone would have been doing CPR to this point,
Firmly to patient's bare chest.
but now they stop CPR while it's analysing the patient.
Analyzing heart rhythm. Do not touch the patient. Shock advised. Charging. Stay clear of the patient. Deliver shock now. Press the orange button now. Shock delivered. Start CPR.
So then you would start CPR, continue the CPR again for 2 minutes. Lots of defibrillators are different. Some defibrillators will have timers built into them. After 2 minutes, it'll tell you to stand clear, assessing the patient again, and then you'll stop and it'll assess the patient. You can usually give up to 16 shocks if need be from a defibrillator, and that'll be around about 32 minutes later. Hopefully the ambulance will be there by then. If you're lucky, the first 1 or 2 shocks may be enough to bring the person back to life. All right. So that'll do us for it, I think. Oh, so that'll be it for the end of the CPR training. Anyone that's doing CPR only, you don't need to watch the rest of the video that we're producing. All right, thank you.